Good afternoon, everybody. It's Dr. Galvin with another COVID update. Haven't done one in a while, but I think we're starting to see more kind of news on the COVID front. Numbers look like they might be going up a little bit. And so there's a couple things I want to talk about. One of those is those rising numbers, but I also want to talk about this rash of hepatitis cases in kids and what may be causing it. Also want to talk a little bit about the fact we've had 1 million deaths in the US and potentially 15 million worldwide, and also some limits that were recently placed on the J&J vaccine related to a rare risk of a complication. First off, these unexplained hepatitis cases in kids. I don't know if you've seen it, but it started out in Alabama. There was a rash of unexplained cases of severe hepatitis in very young children. Now, these kids are too young to get vaccinated, so this is not a vaccine problem, to just put that to bed right away. And these cases have been seen all over the world now, again, in these young, unvaccinated kids. There's been about 5 deaths in the US, and a number of those kids, I think 18 of them have had to have liver transplants, which, if you know anything about liver transplants, that's a very, very big deal. Almost all of them have had to be hospitalized. I think the number in the US right now is about 119. There was initial reports that it was maybe associated with adenovirus, but if you really look at that data, it seems highly unlikely that adenovirus is the culprit. We don't really know what it is now, but there is some strong suspicion it's related to COVID somehow, either a new variant or potentially some sort of hypersensitization of the immune system in these kids from a prior COVID infection, or just a direct side effect of a COVID infection somehow. We don't really know, we're still investigating, but I don't think the adenovirus narrative stands up to scrutiny. And again, these kids are too young to be vaccinated. None of the kids in Alabama, that first group of kids, were vaccinated. Cases are rising, not as badly as they were, but I think we're up to 58,000 cases a day in the US. It's about up 10% from last year. We've got these new very contagious variants. We've talked about, how to handle that risk now that we're not really masking much and doing things along those lines. I think if you're in a well-ventilated space, don't worry about it. If you're on an airplane, put that mask on. That's what I'm gonna do. I've got to fly to a conference before long. I'm gonna wear my mask on the plane. A lot of people, like we've talked about, have been exposed or vaccinated or both. And so we've got some intrinsic protection, but now that we're not masking, these viruses are combining and we're gonna have lots and lots of variants being produced. We'll just have to keep an eye on it. We just hit 1 million deaths in the US, and it looks like potentially 15 million deaths worldwide. It was always puzzled me that we had such low deaths in India. We've got this very huge population close together. We knew that they had a big COVID problem, and it looks like they undercounted the numbers there by 4.5 million. It looks like probably 5 million people died in India from COVID. They were only reporting 500,000, and I think those numbers, as time goes on, we'll get a better sense of those numbers. Lastly, I want to talk about the J&J vaccine. Now, we've kind of, I've talked badly about the J&J vaccine from the beginning because it just hasn't been very effective. About 6% of people have been vaccinated in the US were vaccinated with that one. Remember, that's the traditional vaccine made with a little piece of inactivated virus, just like, many, it's a very traditionally made vaccine. We use lots of vaccines that use that same mechanism. This is not one of the mRNA vaccines that have kind of been, gotten the anti-vaxxers up in a roar. And it hasn't been particularly effective, honestly. Unfortunately, it hasn't been very effective against a lot of the variants and things like that, but it's still, a lot of people have had it. And there's this rare complication called thrombosis with thrombocytopenia. Now, what does that mean? It's TTS is the name. Thrombosis is a blood clot associated with thrombocytopenia, which is low platelets. And a lot of times these are happening in the brain, and about 15% of people that develop this, it's fatal. So it's bad. Incidence is low. 3 cases per million doses of the J&J vaccine. Although for women ages 30 to 49, they're at higher risk, and it's 8 cases per million in that group. And because of that, the FDA has said, you know what? We're going to amend the emergency use authorization for that particular vaccine because we haven't seen these severe side effects with any of the other ones. And so now they're recommending it only be used in people that cannot get an mRNA or other vaccine for some reason, allergy, or they refuse to get it or whatever. And it's got to be people who are over 18. So that's kind of the update on the J&J. It's a little update on COVID. I'll be keeping up to date. We are talking about 5 pillars of health, and as soon as I hang up from this video, I'm going to talk a little bit about one of the first pillars of health, which is nutrition, which is a key one. And those 5 pillars of health that we're talking about in our wellness series is nutrition, fitness, sleep, stress, hormones, all play a big role. So if you're interested in that, look at the other videos. Stay safe, stay good. I'll talk to you soon. Bye.